everybody. I'm the other Dr. Kelly, Dr. Kelly Sadauckas, and I am a pelvic floor physio, and I'm here to share with you all about why your pelvic floor is important for intimacy. All right, intimacy and your pelvic floor. There's my name, there's my website, and my Instagram. I do so many silly things to make this information relatable and accessible and not scary. So do not hesitate to check out my blog and the website or the Instagram page. Like if you have a friend who is peeing her pants all the time, or one who is limited by pain with intimacy, but they're not quite ready to go to PT, recommend like this social media account for them to follow, because it starts to bring up the topic and makes it so much more comfortable. All right, so pelvic floor health, it's vital for intimate function and for overall health. There is so much for blood flow, just general tissues being happy and healthy, and brain-body coordination. They're all involved in pelvic floor health. So how well do you know your pelvic floor? Like, do you guys even know what we're talking about when we talk about the pelvic floor? So we did a whole nother talk all about this, and I recommend watching that, but I'm gonna give you like the 1 minute lesson on your pelvic floor. So this is Patty the pelvis. She's a pelvis with traditionally female anatomy, and we have your low back and your two pelvic bones there. Your pelvic floor are these cool muscles at the bottom, and it goes all the way from tailbone to your pubic bone in front. But what is so impressive is it's not just one muscle, but it's more than 12 muscles on each side. And it's frankly amazing that it ever works in the first place. The pelvic floor, here's the bladder, and here's that cute little vag. While this is smaller than real life, the relative position of this is accurate. Like, this is about the size of the pelvic floor in relation to the vag and in relation to your sweet little bladder. And then your cute little butthole goes right back here. This is meant to live a ground floor, like a chill, relaxed place. And with all of those changes that the other Dr. Kelly just told us about, a lot of stuff was like stress and anxiety and dryness. And that will result in these muscles not being chill, but resting too tight. And that resting too tight is the harbinger of doom for our sexual function. I have an amazing costume that is a vulva that is too hot for me to wear right now. I'm so sorry. But this is the vaginal opening. And as Dr. Kelly mentioned, the clitoris would be here, and this has to move. But the nerves for sexual appreciation, it's kind of hard to find. I'm just joking. Look how big these are. And they go all the way down the pelvic floor, like aside the vag here, all the way to that perineal space between the vag and the rectum. And they also go all the way around the front. And those are the nerves that can allow you to feel normal intimacy and enjoyment. But if we don't have that proper resting tone of that chill pelvic floor, the muscles are going to be super tight. The door is literally going to close, so nothing's going to fit in there. And if I'm that sweet clitoris that needs good blood flow to feel all the feels, and I'm kind of getting strangled by all these tight muscles, I'm not going to be so excited about intimacy. Additionally, when they're so tight, that's what causes leaks. 99% of the time, we don't leak because we're so loosey-goosey. We leak because they're tight all the freaking time, and they don't have any strength left. Well, and they're annoying the heck out of our sweet, tiny urethra. And then they don't have any strength left to hold in the pee when we laugh or cough, and we get that big pee urge. Additionally, prolapse-y feelings. The vaginal estrogen that Dr. Kelly talked about can help kind of hold things actually in the right place. It's hugely important. But if I am your bladder and I'm supposed to be supported by your tummy and your butt muscles and your back muscles, and your pelvic floor is supposed to be down here, what if my tummy's not doing enough and my pelvic floor gets real tight? all of a sudden my bladder is kind of like right there at the level of the vulva. And I might feel a really uncomfortable pressure, but it's not actually a true prolapse because we just need to get the pelvic floor down and then teach the other muscles how to help support that tissue. Or meeting with an amazing doctor like Dr. Kelsey and Dr. Kelly, getting some of that hormone replacement therapy, either in perimenopause to keep the collagen health there so the bladder doesn't sink as much, or at least that vaginal estrogen in menopause, even if it's 30 years later, to help that tissue health. The pelvic floor, I talked about how when it's too tight all the time, it can cause leaks. Well, if it's too tight all the time, just like you might be too exhausted for sexy time, your pelvic floor could be too exhausted too. And you're just really not going to have any libido if it's all the way clenched up here all the time. That resting tone is necessary for us to feel confident. It's hard to feel sexy and confident if our crotch hurts, if we're peeing our pants, if we don't feel like we know what's happening with our own body, if we can't describe what we like to our partner. And we talked about the clitoris as a whole, and the muscles might strangle it. It's not the only nerve down here, team. Look at these incredible pictures. And I'll make sure that Dr. Kelsey and Dr. Kelly share these slides with you guys too, because it's fascinating. They're through pelvicglobal.com, which is another way that you can look for a trained pelvic floor physio near you. But the top picture is the pudendal nerve. Does anyone know the Latin root of pudendal? No. It means to be ashamed of. Doesn't that make you so mad? Like
No way. I didn't know that.
Yes, to be ashamed. It is ridiculous. It makes me so angry that we still use it. But like that is when we're naming nerves. Like we named this primary tripartite nerve that we should be ashamed of down here. Oh, wrong. It should be like the amazing nerve, the nerve of awesomeness. But it innervates different parts of the labia and the pelvic floor and sensation. That bottom picture shows a million different tiny nerves that are there. And wait, it gets cooler. All these different colored spots here tell you the different parts of the skin that are innervated by different nerves. So in pelvic health, it's not just about the vag. Like, what if you have inner thigh pain all the time, or you get a hip cramp with sex or with climaxing? Or you know what? And I get a little burning sensation down there. Okay. Is it true to true vaginal dryness? Is it due to the door closing, either at the muscular level? If you notice your labia whitening, there's a lichens process. It's called lichen sclerosis, like that can happen as we age. And that's an actual thinning of the connective tissue of the vag. So if we notice that change, we can treat it. We have to notice it. If you're having pain, diving in deeper, or numbness, where is it on these pictures? Because you saw all those nerves before. This big picture on the right also shows you nerves that come from the low back that affect labial sensation, pelvic sensation, and muscle control. It's never just about the clitoris. There's all of this different stuff. So I include these pictures so that you can be a little bit more self-informed. And if you are actively having pain or numbness, try to delve in and name it. Figure out, okay, oh, you know what? Mine is just at this teal color or just this green color. And then go in to a trained pelvic physio and they can work on releasing that nerve for you. It's awesome. So we need this normal resting tone so those nerves can be happy, so we don't hurt and we don't leak, and we have the capacity to have enjoyment with intimacy, or just to be comfortable in our own bodies. You know, Dr. Kelly said, if it matters to you, it matters to us. And this isn't my talk. I'm going to tell you what you need for optimal sexual function, but it's also all the things that you need for a pain-free, leak-free, prolapse, pressure, minimal to free life. So the parts that I mentioned that are needed for orgasm, if that doesn't matter to you, no problem. Still stay with me so that you learn about your awesome pelvic floor. So for us to feel desire and have a climax, the brain needs to know how to connect to these pelvic floor muscles and calm them down. So in our other talk all about the pelvic floor, we go into this super in depth, but for our purposes right here, tune in to the space that I'm assuming you're sitting, listening to this. If you're not sitting, hit pause, go sit down. Tune into the space like where your bikini sits. All right. And understand that your pelvic floor goes all the way from your tailbone around the rectum, around the vag, and around the urethra, and kind of side to side as well. Now, can you do a Kegel, which is the deliberate lifting of just that bike seat bikini part up away from your chair? I go like this, away from my creepy fingers, lifting up and hold that for 3, 2, 1. Here's the more important part, friends. Can you relax? And 9 times out of 10, we can, no matter how tight we're resting, we can find a little bit more of that Kegel. But then when I ask you to relax it on purpose, your brain honestly doesn't know how to do that. And if it doesn't know how to do that, how is it going to relax for penetrative play? How is it going to relax to take pressure off those nerves that were causing pain or numbness? So we can teach you in pelvic physio those basic connectors. In that other talk, we kind of go through, I have a group of exercise called the big 3 that we can sit on a rolled towel or a pool noodle or a cooch ball is my favorite to learn how to move these things slow. Additionally, can we keep the pelvic floor relaxed while you tighten your tummy? Ooh, that's a really hard one. And that's important because if we are being intimate, normally we're not just laying there stock still. Normally we're moving somehow. And if your pelvic floor clamps down every time you try to move your low back, you'll have a hard time climaxing. You might be painful because, again, the door closes. When the pelvic floor is resting at the perfect level, which is the ground floor of like a 4-story building, penetration and squeezing the pelvic floor puts just enough pressure up around that whole clitoris to feel good. But something we don't always know is that the vag itself doesn't have a lot of nerve receptors inside of it. All the feel good stuff is up here. But with happy pelvic floor tone, we can push that penetrative pressure onto the right spot. If the door is closed, that actual angle changes and there's too much pressure and things don't feel good. Now, in addition to slow movements, climax is essentially plyometrics for the pelvic floor. So if we don't know how to use our muscles slowly, there's no way that we're going to be able to have that fast, automatic, rhythmic contract and relax of the pelvic floor that's necessary for a climax. And you might need to, work up to the harder task or practice, which is self-play and masturbation. And as Dr. Kelly said, it it is about preventative health, not just this like luxury of being able to enjoy intimacy. But there are steps. If I haven't been able to enjoy intimacy for 20 years, I'm going to need to start with those basic big 3 connectors, learning how to relax my tummy and Kegel and then relax my pelvic floor. I'm going to need to learn how to tolerate. I mean, what if my partner or my toy is this? It's very different than if my partner or toy is this. And I pity the woman that has to deal with this. I'm so sorry. And what these guys are, I'll sharing my screen at the end and go over. These are vaginal dilators, but I'll wait till I have a bigger screen to show you those. And if we can't climax, you can even use the vibrators just to help soften the tissue, to get you to the point where you can feel that contraction and relax of the pelvic floor. And studies have shown that vibration does improve tissue softening even more than just standard pressure alone. So if I'm seeing you in the clinic, often here's the inside of the pelvis. Often we're doing some internal muscle work to help you find all of these spots and relax them. But if you're doing this at home, just this is how far we can get with our finger. We can only get like 1/10 of this spot. So these amazing tools called pelvic wands, and I'll show you on the big screen as well, that we can put in and hold. And this one vibrates. Well, you probably can't hear it, but it's got all different vibration patterns. And not only is that useful for perimenopausal and menopausal women to soften that tone better than just pressure alone, additionally, a lot of us have this subconscious contractile response, especially if sex has been painful or if there's some shame issues. Using this vibrator, once you figure out how to calm the muscles to turn on that vibration, can the muscles stay calm? And that's huge because that will really take your climax up to the next level because there's better circulation. Dr. Baxter noted that sex intimacy is biopsychosocial, which is physical health and mental health plus happy pelvic floor. That is all integral in your libido. So, are you going to your basic wellness checks? What are your basic blood values? What's your blood pressure? What's your iron? What's your cholesterol? All that stuff matters. So, make sure you have that low hanging fruit taken care of. And the trained provider will tell you, like, oh, you know what? This is interesting. And if you've gone to your basic provider, okay, I'm going to tell you a secret. Dr. Kelsey and Dr. Kelly, they're not basic. They're like queens in this. If you go to a basic provider and you're like, I have no libido. Oh, I feel terrible. And your provider's like, oh, your blood work looks good. They might just be looking at this terrible Western standard of, okay, you're not imminently dying, but there is a range that's more ideal. And a queen provider like Dr. Kelly or Dr. Kelsey, or anyone who's on that Menopause Society list, I don't know, you have other ones too, they are going to know what actually is ideal to help you thrive. And finally, that emotional space for intimacy. Like Dr. Baxter said, it is such a vulnerable thing to be able to talk about what you want with your partner and even with yourself. And that's where I start to recommend. I'm like, if you've never done self play, start to try. Um, Here is the top of the labia, and here's where the clitoris is. If we just like pokey, like that's not going to feel good. You want like pressure here with like fingers, and we want to go like side to side if you're doing like manual self play and like alternate pressure. I don't know if ladies don't know that. And we need to like be able to talk about that is it's the clitoral stimulation, it's the external stimulation that will get you engorged, that will activate that fancy receptor Dr. Kelsey and Dr. Kelly told us about earlier to help us feel that climb. And that climb is like this increasing, ooh, this feels good. Ooh, I like that. Yes, keep doing that. And then we climax and tissues relax and should feel amazing, not hurt. Okay, coming back to screen share. Where did my screen go? Oh dear. Okay, we'll just open this again. There we go. Oh, no. Yay. So playing with yourself and improve, like understanding, talking to yourself. What do you like? What do you not like? You know what? I don't like this. I don't like penetration. I only want external play. Absolutely fine. Tell yourself that. Tell your partner that. Ideas for improving sex time are coach balls daily. And I'm going to stop sharing and do this on the big screen in a second. Dilators are wands, stretching your legs and hips with a deliberately relaxed pelvic floor. A simple stretch we call a 90-90 stretch is when you sit on the ground with like make your legs make like L's and then you go to the other side. Sweet. And you do that with a relaxed pelvic floor. Can you stretch your hamstring with a relaxed pelvic floor? What about with a little pelvic tilt now? Hey, because in intimacy, you're often going to want to be gyrating a little bit to get the pressure on the good stuff. But can you do that with a relaxed pelvic floor? Learn what excites you and talk about it first with yourself and then with your partner. Erotica can be really exciting, like spicy, trashy romance novels. Figure that out. That's okay. It's absolutely amazing. And again, be really open to self play because that's how you're going to learn what you like. All right. Without the screen share, I wanted to show you some of those tools in a little bit of a bigger realm. So here's Patty the pelvis. Here's how we get to in pelvic PT. Here's how much you could reach if you are trying to investigate yourself. A pelvic wand can help reach a little bit deeper all the different directions. And you essentially, it should be pain-free to do. And if you're having some pain or problems climaxing, it's not going to be pain-free. You're going to find like a spot. We don't want to be like dying of pain, but you find a little hot spot and you hold gentle pressure on that while you belly breathe. And it might take 2 minutes, it might take 5 minutes, but eventually that spot will soften. And then keeping the gentle pressure on that spot, you would practice contract and relax. You'd practice relaxed breathing. You'd practice trying to keep your pelvic floor relaxed while you do those little pelvic tilts. The vibrating one is exactly the same, but we just plugs in this little two things there and it charges and it has like a bunch of different vibratory modes that you can use. Another cool, amazing tool is, let's say that the width of the toy or the partner is fine, but the depth is making you a little nervous, or the feeling of, oh, they're hitting my cervix. It's really never the cervix. It's always the pelvic floor muscles. But you can get these things called O nuts from the pelvic people and go around the base of the toy or the base of your partner. And they come in like a set of four. And there's even a vibrating one now. They call it the Rumble Bumble. Yeah, Rumble Bumble. And essentially, there's less fear of hitting that hot spot. And so you can each enjoy intimacy a little bit better. And then you can go from like 4 to 3 to 2 to 1, or continue to use all of them if you need to. And it just, again, since it removes some fear and anxiety from both partners, it can make things more enjoyable. If you can't tolerate for a medical exam, or if we're wanting to like, okay, I just want to know what if I do meet a new partner 30 years later? Absolutely. You can start with a vaginal dilator just like this. And you use good lube. And we would also recommend, of course, work with a trusted primary provider to get on some vaginal estrogen or moisturizers or that DHEA. And you practice inserting this and just relaxing and like having it in there, not holding it in, but literally trying to relax for 10 to 15 minutes. And then you can do a few of those big three exercises, focusing on how do the sphincteric muscles feel? How does that opening, how does the door open and close? And then you just progress level by level. Those ones look kind of the same to me. I guess blue is a little bit bigger until you get to your target size, which is hopefully not this for most of you. Dr. Baxter also mentioned rectal dilators. They're like my favorite besides the cooch ball. Here's all of your pelvic floor muscles. Even if we're not planning to put anything in the rectum ever in play or in life, the rectal muscles, this is going to be like the second thing that's going to blow your mind. And I'm going to tell you, the first, hopefully, was that your problems are because the muscles are too tight, not too loose. The second thing is that rectal tightness causes so much vaginal issues and urinary issues. These muscles back here are like 8 times thicker than the little muscles around the urethra. So any tightness that we have excessively affects these back groups. So you can treat those just like there were those progressive vaginal dilators. We have progressive rectal dilators where you can start just with this little guy. You put some lube on it, lay on your side, pop it in, and relax for 10 to 15 minutes. Following the 10 to 15 minutes, it should be just be super comfortable, and you'll practice relaxed breathing. You'll practice Kegel and relax, practice supported breath. And I have online courses if you're interested. Check out my website. And then eventually you'd progress to almost this size. This guy's a little bit bigger than our base. I'm sorry that I don't have, here it is. Dark purple and light purple. They're 4 and 5. These are kind of the sizes that everyone should be able to tolerate pain-free for normal pelvic function. So if you're having any pelvic pain and for whatever reason, you don't want to be doing any work in front, or you have done the work in front and your symptom has still persisted, highly recommend trying these. They're so flipping relaxing. Like, I do it twice a year to make sure I give good cues. And I'm always like, why don't I do this more often? And again, if it feels intimidating, remember that like it starts all the way down here and there's lots of levels to progress to. And how it helps you feel relaxed is the emotional connection of the pelvic floor to the brain. When your pelvic floor is tight, that just tells us that we're not safe. And Dr. Baxter told us, safety is really important. So relaxing the pelvic floor will help with that safety metric. Okay, any other tips and tools? Oh, the couch ball that I mentioned. This is what it looks like. You sit upon it for a little bit more feedback for those pelvic muscles. And yes, doing the conscious exercise of like contract and relax is huge. Even just sitting on this ball for 3 minutes a day can change your world. And it's like you don't inflate it all the way. This one's like half to 3/4 inflated. Don't inflate it all the way. That's too much pressure on the pelvic floor. I think that was all. The one thing that I will, oh no, this is what, vaginal weights. We often don't need these for sexual enjoyment, but like just people always talk about them. So this is what they are. They get inserted. This is a double. There is also a single. Calm things down first and then see what happens with your libido. I probably have recommended these once in 25 years as a physio. So don't have this be your first go about. Focus on calming things down. All right, what questions do you ladies have? What did I forget?
Thank you. That was so good. Ooh, can you explain more about pain with deep penetration and like that cervical pain that's actually pelvic floor pain?
Yes,
'Cause I hear that a lot.
Absolutely.
Great question. I had the same one.
Oh my gosh. And I wish I have this like see-through model that we use to teach people how to do menstrual cups, but I left it at the clinic. Well, I just gotta find my pelvic floor again. How did I lose them? There it is. Okay. So this misconception that it's the cervix causing the pain comes from this model and picture. Okay. Because what does this show? This shows the vagina going straight into the cervix and the uterus, and the cervix being at the end of the tube. This is fake news. In real life, the uterus is kind of like on top of the vagina here, and the vagina extends further past the cervix. And so like this would have to be like kind of like right here going forward. And then when we're about to have a baby, yes, a lot of things happen and this moves and angles so that it is kind of a straight shot. But if we're not about to have a baby, this extends a little bit further past the cervix. But we think we're getting that cervical pain because it's like this intense, sharp pain, possibly in the lower abdomen. But in fact, the posterior pelvic floor muscles radiate pain to the lower abdomen. And so if the door is closed and we're going like deeper, just there's more stretch of all the tissues. And if the tissues are saying, no, thank you, I'm not interested in this, the deeper we go, the more things get stretched. And eventually we'll have that sharp pain. It's phenomenal to understand what it's coming from. A different pelvic floor muscle will radiate to your groin line or your hip line. So if you get a hip cramp with intimacy, that can actually be a pelvic muscle spasm, not really your hip muscle. And it's just that, and a lot of times that will happen close to climax. That's just the worst thing because you feel this beautiful build, and then hip cramp. So those are all things that are pelvic floor muscle mediated. And if it's post hysterectomy, right? If we've taken the cervix, that is one time when, and they might say like, oh, vaginal length may be affected. That might be noted, or it might not. You still can use progressive dilators under the informed direction of a trained provider to help improve that vaginal depth and to help stretch those tissues responsibly. So it's a really great tool. And I will be honest, I use the Cooch Ball with like everyone. I use rectal dilators with about 25% of my clients. And this is the progression that I typically go is like Cooch Ball, rectal dilators, because it's just the easiest. You just plop this in and like read a book for 15 minutes. Please never put anything up your butt that's not designed to go up there. Thank you. It will get lost and you'll have to go to the ER to get it removed. But if you do, please share me your x-rays. Then I typically use pelvic wands to get to those hot spots. And you usually like, I know it sounds really complicated, but like, it's so simple. You find the spot, you're like, oh my God, that's my pain with intimacy. And it's like almost always a muscle called your obturator internus. That's like a little bit over here to the side. That's the one that causes the pain. but we can teach you how to like use the wand to find that spot and breathe into it. And it's the same as just getting a kink out of your neck. It just happens to be in your pelvic floor. And the tools that I use the least are actually vaginal dilators. And I think that's because of that muscle size, like the vaginal groups tend to chill out. And once they are at the normal resting tone, if pain with intimate, which is pretty easy to get to with just the cooch ball for most of us, usually the remaining hypertonicity is rectal. And then are they also having constipation? Like, yeah, they probably are, or hey, I have to use my Miralax and magnesium every day. And that's common. And so like when I do this assessment and I feel these muscles are tight and they've told me they're a great pooper, I kind of then like, well, I take magnesium every night. I take my Miralax. That's not a great pooper. And so we really see all of these things. And like intimacy, being able to poop is really important throughout our lifespan. And it can reduce a lot of prolapse problems and leak problems and just make us a lot more comfortable when we can poop well. And as the pelvic floor calms down and poop gets better, voila, all of a sudden sex doesn't hurt. And then after we can get sex to not hurt, then we can start, hopefully we're also doing some self-play. We can start experimenting with how to make sex feel good.
So cool.
Yeah.
Thank you.
Yeah.
Why do you think it is that nearly everyone, their struggle is more of a too tight pelvic floor? When I feel like in the world, a lot of people think, oh, I don't have a strong enough pelvic floor, is what like 99% of people think, when actually it's the total opposite. Like, how are we so backwards on this?
I know. Well, I think we can thank Dr. Kegel from the
Totally.
60s. I mean, he invented this archaic thing. So Dr. Kegel, bless his heart, he found, and this is an error that many well-meaning providers, if they're not well-informed, if we have this really overactive pelvic floor, the Kegel is going to be weak on demand because the muscle's freaking exhausted. So you can have this really tight pelvic floor, and if a provider has like a gloved finger in there and they say, oh, do a Kegel, not much is going to happen. But it's not that they're super loose, it's that it's already in a Kegel. So like the one additional step that providers can take is while their finger is inserted, they can do what's called a pelvic clock. And PTs do it for all around the clock, 12, 1, 2, 3. But a provider could even just try to go to the front lateral corner. Is there any give on the tissue? And 9 times out of 10, there's going to be no give. And the same thing going back lateral corner. It's not going to move. And that should move 2 centimeters in the back lateral corner of the vag, 1 centimeter in the front lateral corner. The rectum should move 1 centimeter in all directions. So if we only have the metric of how hard can you squeeze, you're missing a huge part of the picture. But so to Dr. Kegel, Dr. Kegel's perenniameter, okay? So you insert this up in the vag, or there's one for the rectum as well. And then you inflate a little bit of pressure into it here to get feedback. And I don't even think he did that feedback part. And then you squeeze to see how much pressure you can do. And he trained ladies to squeeze, and he found that they got better. Now, knowing what we know now, a lot of that better was because they were squeezing and then accidentally relaxing. Because as soon as we get you out of this 4th floor roof, the muscle all of a sudden has spare energy and resiliency to give. You've given it a little break, so now it can be stronger. If I put you guys in a wall sit right now and told you to sit there for 8 hours, how strong are your quads going to be when you get out of the wall sit? Not strong. But if I take you out of the wall sit now for like a whole day and now test the muscles, they're longer than a day probably, but they're going to suddenly be stronger just because I took that too demanding load off. But Dr. Kegel was the first one to say, hi, I've saved women. Yay, I'm so amazing. Do these Kegels. The problem with that is nobody knows what's happening down here. Nobody knows they're so tight. And so when people just do Kegels, and this study was in the 80s, we found that if I just told you to do Kegels, 100 women, half of you would get no benefit because you weren't doing it right. A quarter of you would be doing it so wrong that you'd actually make yourself worse because you're just tightening, you're not relaxing. And only a quarter of you, by the sheer grace of God, would get better. And that was just by luck. But since Dr. Kegel was the first one to talk about this, that is the message that prevails today. As to why it's tight, it's everything. It's life. Our pelvic floor is wired to our amygdala, which is our emotional response center of the brain. And it's our reptilian brain, our survival brain. And one of the most important like tenets of survival or responses that it will do to try to protect you is if you feel or perceive danger or stress, your pelvic floor will tighten. It's a stress response. It's a danger response. And this is real danger or perceived danger. It's any type of stress that pelvic floor will tighten. And since we're a puritanical society that doesn't talk about these ashamed parts, we don't know that it tightens in response to stress, and none of us can live without stress. And unless we work to address that body reaction that's very normal to stress over our life, it just keeps tightening. And it's not just people who've had babies. Yes, if you've had babies, that's a freaking huge stress on your pelvic floor, regardless of vaginal or cesarean delivery. And then once the baby comes out, the tummy is underactive because it's like 80 miles long and our brain doesn't know where it is. And so the brain recruits the pelvic floor to stabilize. And unless we then later teach the pelvic floor, hey, you can chill, tummy can work again, that stays tight. And then we're not sleeping and we're stressed. So the pelvic floor tightens. And maybe I start peeing my pants. So I reduce my water intake. And that's terrible. That pisses off the bladder. My pelvic floor tightens. And the final reason is in women, as we lose collagen as we age, if we haven't had the HRT, as that estrogen drops, the collagen of the whole system changes. And my face and my boobs don't look the same as they did when I'm 20. Same thing, like for if you look at all of that pressure and passive support the collagen was giving the organs, it's not giving it anymore if we haven't kept with some level of HRT. So there's overall more pressure down, which lends to an uninformed pelvic floor ends up cranked up to try to counter that pressure. And that's the wrong thing. We want it to chill and we want the tummy and the back muscles to take up that slack. But that's why, because it's our body's natural response to pain to tighten the pelvic floor and stress and life be stressful.
Yeah.
Yeah.
Oh, thank you for that. Yeah.
Of course, that's a great question. Thank you for asking.
Yeah. This was great. Thank
Yeah.
you
So
so
fun.
much.
So fun. Yeah. So any other questions about the pelvic floor stuff? Like I said, check out my blog. There's 2 specific courses, Leak Lab and Poop Lab, and both of those are perfect for improving sexy time as well. There's one called Vag Lab that's currently off, but it'll be back on soon. And I'm sure eventually there's going to be a 6 at a time only special on there. So
Love
always
that. Yay. Thank you, Dr. Kelly.
Thank you so
you guys.
much.
Yes.
Thank you guys for coming. Appreciate it.
Yay.
Yes.
Yay.
Everybody have a great night.